explain what the word dope means?
Dope.
Dope.
Dope. Dope.
Dope.
Dope.
Dope.
Dope.
Dope.
Dope.
It's just dope. Dope.
Doctor or provider side is that, like we alluded to earlier, is that you have to give a prescription, which is not the case. Is that you are verifying that a patient has these conditions and they're coming to you for that and that alone. It's not your right to say whether or not they're allowed to use it, or
Right.
that's not your job. Your job is to verify that they have the condition and to allow them to move forward in taking control of their healthcare. And so I think that is a misconception that people have. It's like, you're not prescribing anything, it's not illegal, you're simply, just like you would if a person came in and needed any other form, like a FMLA form. You just have to say, like, they got hurt, this is what happened, and now I'm signing off on it. You're not saying that you was there and saw them slip and fall. It's none of that. It's verification. And for the patient side, I think is that you can't be functional or be productive and be a medical cannabis patient or a cannabis consumer, because the two can go hand in hand. And that's where I think having a doctor like myself who is invested in cannabis, or I guess that's the right word, invested in energy into learning about the plant and how it helps people and the best ways to sort of consume and be productive. Because a lot of times, and what I often tell patients is, the conditions that you're being qualified for, they don't go away because you're on the clock. If you have chronic pain and you sit at a desk, your pain is likely going to be worse when you're sitting at a desk for 8 hours. And if you have to wait until 5 p.m. or 6 p.m. when you get home to consume in any form or fashion, then that is not, you're not living in your best potential. And so really being able to help change that that thought process for patients is one of, I think, a super big misconception. Because people would take opioids during the day. Like, you don't think twice. If you're in pain, you'll pop a Norco, you'll take a, sorry, my dog came in. Come on.
Oh, okay. Let's see. Oh. Okay, he, she.
I'm a dog mom. He, Charlie.
Charlie. Hi, Charlie. Charlie's
All right,
handsome.